quarter of people in the UK live with chronic pain every single day, and far too many of them feel unheard and totally misunderstood. Something Dr. Amir wants to help with today in a very special chronic pain clinic. Amir, firstly, at what point does it become classed as chronic pain?
Yeah, so chronic pain is any pain that's been going on for 3 months or more, often after the injury or illness that caused that pain has healed. Now, lots of people live in chronic pain, 1 in 4 people, but they're often just given painkillers or told to get on with things, and their root cause hasn't been found, and that can make them feel dismissed or hopeless. Now, when we look at chronic pain, we categorize it in 3 main areas. The first one is called nociceptive pain. Now, this is something that lots of people may be familiar with. It's when there's a direct injury or an illness that we can see and test for, things like a sprained ankle, arthritis, gout, that causes that pain. It's often short term until that illness heals. The next one is neuropathic pain. This is from nerve irritation or inflammation. But often what happens is the nerves misfire and send excessive pain impulses back to the brain and spinal cord, which interprets them as very sensitive pain. Things like shingles, sciatica, diabetic neuropathic pain is in that category. The third one is very, very common, and it's new to us. It's called nociplastic pain. This is when the whole pain system becomes oversensitive. The brain and spinal cord amplify pain signals. It's like turning up a speaker to maximum volume. And often this doesn't show up in bloods and scans, and people are often thinking that it's in their head. It's not in their head. It's very real. It's just a different type of pain.
So actually, you've already come quite a distance if you know the reason, like you're trying to explain there, Amir. A lot of people are in pain, of course, and they're not exactly sure what is causing it. And there's so many common conditions, isn't it? And it's very sometimes hard to nail down exactly what the root cause is.
That's right. With nociplastic pain, like I say, there's no test, but knowing that it's actually this type of pain can help. Conditions like fibromyalgia falls into this category, extremely common, widespread, oversensitive pain where the brain really is very sensitive to even light touch. You'll have good days and bad days with fibromyalgia, exhaustion, brain fog, all of that comes along with it. Long COVID is another one. The virus may well have gone, but it's inflamed the nerves, it's confused the nervous system, and that can lead to chronic pain. And IBS, irritable bowel syndrome, is another one. The gut-brain axis is misfiring. The nerves in your gut have become very sensitive. No test can test for it and diagnose it, but we go on your symptoms. And simple things like digestion, stress, oversensitizes those nerves and gives you those symptoms of irritable bowel syndrome. Remember, it's not in your head. We just don't have a test to diagnose it yet. Doesn't mean it's not real.
Yeah, exactly. And it's so utterly exhausting for people. And why is it, though, Amir, that chronic pain disproportionately impacts women?
It certainly does. So women are more at risk of conditions that cause chronic pain because they have the whole gynecological system. So things like endometriosis, adenomyosis, fibroids all cause chronic pain. But also their nervous systems are different to men's. They're more sensitive. They feel pain more intensely and for longer. Estrogen plays a part. It intensifies pains. It affects your immune system, which then can cause inflammation. But also painkillers. A lot of the tests done for painkillers were done on men, and they don't work in the same way as in women. We need painkillers specifically for female type pain. And emotional, physical, sexual trauma, all that trauma plays a part in chronic pain and how intensely you feel it. And women, unfortunately, are more at risk of those things as well.
Oh my goodness, I didn't realise that about the painkillers. And sadly, if you're in any kind of pain at all, you lean on the painkillers, and they have their drawbacks as well. You don't want to have to take a painkiller every single day.
That's right. When you're living with pain all the time, anyone will tell you you'll do anything to get out of it. And often reaching for painkillers feels like the only thing that might help. And it might help in the short term, but in the long term, it can cause more harm than good. And if you are on painkillers long term, you really should be under a specialist for that, because painkillers themselves have side effects. You can become tolerant to the dose and then need higher doses just to achieve the same effect. You can become dependent on it as well, particularly with opioid painkillers. That seems like codeine, tramadol, morphine. People feel trapped on those painkillers. They may no longer work, but they're worried about withdrawal of coming off them. Constipation, brain fog, tiredness are all common side effects. And we should be looking for things like the root cause of these chronic pain and managing that better. But it is really hard. Painkillers is a really tricky system. America have got a problem with painkillers with lots of people addicted to them, and we need to make sure that doesn't happen here.
And as you say, you talk about the root cause, though, Amir, it is a case of you having to really just, or maybe it's making a diary, making how you feel during the day, and just going to your doctor with as much information as you can to try and get a diagnosis, to get you off the painkillers and get your life back.
Yeah, and we wish it was as easy as that. Often we refer to pain clinics where they slowly taper off these drugs and try and put them on other things if that is at all possible. But again, knowing what's causing the pain or not causing the pain may help. Knowing when your good days and bad days are, not overdoing it on your good days, but perhaps doing as much as you can. Trying to desensitize your nervous system through gentle movement and exercises when you can. CBT, mindfulness, all of that, and physio can help as well.
Yeah. Finally, Amir, if you are living with someone who is suffering with chronic pain and you just can't do anything to help them, you feel helpless, what advice would you give to them?
Yeah, this is really important. So don't judge people on the way they look. If they suffer from chronic pain, they may be struggling with that pain, but they have to go to work. They have to look well. Just because they look well doesn't mean they're not struggling. Don't tell them to push through it. That's the worst thing you can do. Only they know what they're going through. Try and listen to them and ask them how you might be able to help. And also, don't just try and do things for them. Try and encourage them to do things themselves if they can. Understand their good days. If they have to cancel plans, understand that's because of their pain. It's not because they're flaky. And it's really hard for people living with any chronic illness to plan anything in advance because they don't know how they're going to feel on that day. So try and understand if they can't make things and have to cancel at short notice.
Yeah, completely. And you can understand how mental health and everything can suffer because of that. It makes complete sense if you're feeling this amount of pain every single day. It's an awful position to have to be in, and you have to deal with that sort of that whole rounded health perspective with people, I guess.
Yeah, mental health plays a huge part in this. Mental health makes pain worse, pain makes mental health worse. It's a vicious cycle. And do speak to your doctor if you are struggling, because we might not be able to give you tablets, but we can point you in the right direction. And lots of areas have chronic pain or living with pain clinics that we can refer you to.
Yeah. Thanks so much, Amir. You just want to be listened to when you're in that position. Thanks so much, Amir.
Yeah,
you're great.
thank you.
See you soon. Hi there. Thanks for watching our YouTube channel where we upload new videos every single day. You can click here if you're interested in this video or head to the homepage for some more amazing content.